Today's session, we are going to talk about how to approach a short case of amputated limb. So, in the exam, you can get a patient with amputated limb or with or without gangrenous toes. Those patients are usually presented with peripheral vascular disease. So, in this case, you have to examine the both lower limbs. You have to examine the amputated limb first and then the normal limb. So the examination order is first you have to examine the stump. Then secondly you have to examine the scars. Then third you have to examine the peripheral pulses. Fourth one is the contralateral limb, the normal limb. Fifth one is the nicotine stain and other related comorbidities. So in the amputated stump, you have to describe the anatomical level of amputation, whether it is below knee amputation or above knee amputation. And you have to comment on the skin wound, whether it is healed completely or not. Then you have to exclude the fixed flexion deformity. So for that, you have to ask the patient to flex and extend the knee in the below amputation. Okay, so this is done in below knee amputation level patients. And you have to examine the skin of the stump, whether the skin moves freely or not. Then you have to examine for scars, the scars of previous vascular bypass surgery. So sometimes scars can be presented in the abdominal area. So you have to examine the abdomen. Then you have to examine for the peripheral pulses of the affected limb. You have to comment on whether there is presence or absence of pulses and the pulse volume. Then in the contralateral limb, the normal limb, there are 5 things to examine. Whether there are toe amputation, gangrenous toes, ischemic ulcers. And in second, you have to comment on the skin temperature. You have to feel the skin temperature. Third, you have to calculate the capillary refilling time. And you have to examine the all peripheral pulses and comment on the pulse volume. You have to examine femoral, popliteal, posterior tibial and dorsalis pedis pulses. And then you have to auscultate for a femoral groove. The fifth, you have to examine the patient for whether he is having nicotine stains or not. So what are the good features of a stump? You may have to have adequate length, well-healed scar, and soft tissue bulk, and there is approximate proximal joint mobility, a good mobility, and the shape of the stump, and the muscle power of stump. You can comment whether it's whether there are good features of the stump or not. And what are the indications for amputation? They are dead limb or dead lost limb. So in short case examination, you can comment on these things and you can done it less than 5 minutes. Okay, that's all.